Okay, guys, so welcome back. We're going to be reviewing this presentation now, AI's role in precision medical diagnostics. So harnessing AI to enhance accuracy and efficiency across diverse medical specialties, from early detection to treatment planning. In other words, what can you do with AI that you're already doing by yourself? So in other words, what can you replace? How can you replace yourself and still remain the head physician or the controller of the situation? So AI versus dermatologists. Skin cancer diagnoses. So they have an AI looking at over 100,000 dermatoscopic images, okay? And it's assessing for the presence of basically cancer, already more accurate. I want you to look at the year of the study. 2020, at the lower, you can see the article number as 41591-020-0942-0 at nature.com. This was back in 2020. Like, we were talking COVID back in those days. 95% accuracy at detecting malignant lesions, outperforming actual expert dermatologists who were actually at 86.6% accurate. So 95%. So what, 5 years ago? So reducing both false negatives, missing actual cancers, and actually false positives, misclassifying benign lesions as cancerous. So it's already taking place in dermatology. Now let's look into breast cancer detection. 100% detection accuracy. AI systems achieved 100% accuracy in identifying malignant tumors, matching the performance of expert radiologists. Look at the year 2020 or 2025. This led to significant reduction in false positives by 6% and false negatives by 10%. During mammogram screening, improving early detection rates. What does this mean? So this is what it means. In the future, family physicians will do detections of this. Since you prescribe mammograms for your patients, what about having the machine at your office that you actually just run the mammogram there yourself? That's where we are heading towards, okay? AI enhanced colonoscopy. AI technology is significantly improving the detection of precancerous lesions during colonoscopies, enhancing fight against colorectal cancer. 50% increase in adenoma detection rates. So basically, the AI system works in real time while they're doing the colonoscopy, and it's using advanced computer vision to highlight subtle lesions and flat adenomas that might otherwise be missed. This augmented intelligence provides a critical second opinion during the procedure. We should biopsy that lesion. It looks like a flat adenoma. It's beginning just now. 50% increase in detection. Look at the year, 2020. It's like saying, why would you do anything without AI nowadays? Diabetic retinopathy. So already you know this. You know, this is part of your routine screens that you send your diabetic patients for on a yearly basis. 94% detection. What would you send your diabetic patient now to an ophthalmologist or an optometrist? First, just check it. Do they have diabetic retinopathy? No. In-office assessment. This is where we are heading to. What you used to refer people is going to come back to you in the future because you will have the technology to run it yourself. So AI versus medical specialists. Dermatology, again, another study 8 years ago. Dermatology skin cancer. AI demonstrated diagnostic accuracy equivalent to a panel of 21 board-certified dermatologists in identifying malignant melanoma. 8 years ago, they were saying that it was matching human experts. Cardiology, ECG. How many times do you do ECGs? This is like your bread and butter. Now with 92% accuracy in detecting various cardiac conditions, including arrhythmias and MIs. You can just imagine the potential of these technologies. This was 2019. This performance significantly surpassed 80% accuracy of human cardiologists. Human cardiologists that you're paying a fortune are less accurate by, that's about an eighth. So about 12%. It's about an eighth than a computer system that would run it basically immediately. So imagine you then install that on the ECG machine. Simplifies your job. AI-powered Alzheimer's detection through speech analysis. Hey doctor, I want to know if my grandpa can keep on driving. I think he has Alzheimer's. Okay, let's just run this test on. It's looking at the patient's 91% accuracy, non-invasive, 2021. So I don't know where these technologies are particularly. Maybe we should look more into detail of each of these studies, if they ultimately resulted into actual technology that is now on the market that you could implement. But if you're a working geriatrician, wouldn't you want to have conversations where you're screening patients for cognitive issues, to have something like this analyze that conversation and then give you out immediately, right after, 5 seconds after? 92% probability this is early stage dementia. I don't know how it subdivides after early stage Alzheimer's disease. Immediately, if you have that, you can recommend, okay, let's do these medications then, or let's propose a workout a workup of this, So real world impact emergency care, critical minutes saved. AI powered triage CT scans rapidly identified acute intracranial hemorrhage, significantly reducing diagnostic turnaround times for emergency stroke patients. So then you would have an automated protocol in the hospital. Anybody that has a risk for such a thing, they're having a stroke, immediately bring them downstairs. They're getting a CT scan. The radiology is probably busy doing something else. Immediately 95% probability of intracranial hemorrhage. Do you want to consult neurology, neurosurgery? Yes. Immediately the consultation is sent over to them. Their pager beeps. This patient on this place has positive brain bleed, 95% probability. This is the image, the assessment by the AI. Do you want us to implement blood pressure recommendations, protocols to target blood pressure below, 115 or whatever? Yes. Expeditive care, orders for the nurse. Begin protocol XYZ by Dr. XYZ for intracranial hemorrhage. Contact family to arrange conversation soon. I'll be there in 10, 15 minutes or whatever. The idea. This is the end of this presentation. I already did this presentation before, but I didn't record it properly. So it's very straightforward. My throat is starting to kill me. I've been sucking on these lollipops to kind of make my throat better. All right, let's continue.